World Polio Day, established by Rotary International. It is a day set aside for public and civil society partners to raise awareness and resources for the global effort to eradicate polio. The World Health Organization, while congratulating countries and partners who have achieved and maintained a decade of polio-free status, asked nations not to relax. This comes as the risk of polio remains until it's eradicated globally, as the international spread of poliovirus remains a public health concern of international concern. Experts are now calling on nations to maintain high immunization coverage and rapid response mechanisms to any potential outbreaks and to ensure the containment of poliovirus materials. Now, joining me on the news is public health specialist Modukbe Olufisoye. Thanks so much for joining us, Mrs. Olufisoye. Globally, we've seen significant progress in the fight against polio, with only a few countries remaining where the wild polio virus is still endemic. Could you give us an overview of how Nigeria has maintained its polio-free status since 2020, and what key factors do you consider that have contributed to this achievement?
All right, thank you for having me. Today marks the World Polio Day, and first an overview of polio. That's poliomyelitis is a infectious disease that targets especially under 5 children, and targets the nervous system in these children. Now, across the globe, several efforts have been made to eradicate polio, and today we can clearly say that with every partner, everyone who has put in effort to eradicate polio, we've made significant progress. And these steps or these strategies include having to identify unvaccinated children or continuously keep the vaccination program ongoing. There's a strategy of a door-to-door vaccination with the polio virus, such that missed children can be covered and ensure that they are not at risk for polio strategies. Yes, we have challenges because of difficulty with access to certain areas, but we can say for sure that so much of improvement has occurred with keeping Nigeria polio-free. We have, just a few cases being here and there with the particular strain of the polio virus, but several the strategies are working. We also have campaigns by several partner organizations to ensure that the misinformation about the polio vaccines are straightened out, and then it becomes more acceptable for communities where we still have issues with the vaccination program. We also have translation of polio information in different languages across the globe, and particularly in Nigeria. All partners have worked assiduously to make sure that the polio-free status remains.
Right. Even though Nigeria has been declared wild polio-free, the battle isn't over, so they say. There are still challenges, especially in reaching the zero-dose children who haven't received any vaccines. What do you consider the main barriers to reaching these children, particularly in remote and conflict-affected areas, and what strategies have proven effective in overcoming these hurdles?
All right, so particularly for us, our conflict-affected areas have poor access to these children. The war-torn areas make it very difficult to take the vaccines all the way to them, and even if we do, we're not able to cover a large ground, a large group of these people. Another peculiarity with this conflict-affected area is the misinformation about the vaccine in itself. So you have cases where they refuse outrightly, even when we're able to access them, they refuse outrightly to take the vaccines because they believe that it may cause more harm than good to them. So again, you also have situations where aid programs or the campaign programs doesn't get to certain areas. They don't necessarily have to be conflict areas per se, but you have missed children in some particular areas in Nigeria, maybe because of the difficulty with access to road or the difficulty with social media engagement in those places. So now let's look at the strategies.
That's right. Yeah. Okay. Yeah. You want to talk about
Yes, so let's look at these strategies, especially for these challenges that we have. Like I said before, strategy has to do with the campaign. We are targeting these missed children. We are targeting the conflict areas. Donor organizations, groups, partners are targeting ensuring that these children that are missed consistently, efforts are being made to reach them. And how do we do this? Like I shared earlier, the door-to-door immunization. In communities, especially even in the FCT, you have primary healthcare providers go all the way to homes to ensure that under 5 children are vaccinated. We have booster doses that are still given to these children just in case they missed out on the immunization profiling. You also have the campaigns in different ways, in different aspects, especially with Rotary coming in, for instance. You have walks that help to push this information out to know.
That's right. Well, because of our time, we just must end it here. Modupe Olufisoye is a public health specialist. Thank you so much for your time. Thank you.
Thank you for having me.